Are you dreaming about becoming a registered nurse but don't know where or how to start? If you are confused about all the pathways that there are in nursing and don't know which one is right for you, you're not alone. I was in your shoes once. I used to think becoming a registered nurse was just a distant dream. But after spending 15 years in nursing, working my way up from being a nursing assistant to now a nurse practitioner, I now understand what it takes to become a nurse and how to get there. In this video, I'm going to share the basic essential information that everyone needs before pursuing the nursing career. This is the first video in a 3-part series where I will be breaking down the nursing profession. I will be explaining what nursing is, what nurses do, where they work, why nursing is so important right now, and why it is one of the best careers to pursue in 2025. Be sure to watch this video till the end because the information might be exactly what you need to get started with your nursing journey the right way.
You know, in the world of medicine, there's this incredible group of people who are the backbone of it all. They're the ones on the front lines working tirelessly day and night to make sure patients get the care they need. They're the ones who hold hands, offer comfort, and advocate for those who can't advocate for themselves. They're the nurses, the unsung heroes of healthcare. In this video, we're going to delve into the world of nursing. We'll explore the diverse roles they play, the challenges they face, and the immense impact they have on the lives of their patients. It's a demanding profession, no doubt, but it's also incredibly rewarding. So, if you've ever wondered what it's really like to be a nurse, or if you're thinking about a career in nursing, this video is for you. Let's get started. Being a nurse is so much more than just taking temperatures and giving shots. It's a profession that demands a unique blend of medical knowledge, emotional intelligence, and unwavering dedication. Nurses are often the unsung heroes of the healthcare system, working tirelessly behind the scenes to ensure that patients receive the best possible care. It's about being that constant presence, that reassuring smile, that calm voice in the midst of chaos. Nurses are the ones who provide comfort and support when patients and their families need it the most. They are the glue that holds the healthcare team together, bridging the gap between doctors, patients, and other healthcare professionals. Nurses are the ones who are there for the good times, the bad times, and everything in between. They celebrate the small victories with their patients, like a successful surgery or a positive test result, and they offer a shoulder to cry on during the tough times. Their presence is a constant source of strength and reassurance. They're the ones who see the patients at their most vulnerable, who listen to their fears and anxieties, and who celebrate their triumphs. Nurses build strong, trusting relationships with their patients, which is crucial for effective care. They understand that healing is not just about treating the body, but also about addressing the emotional and psychological needs of the patient. One of the most important roles of a nurse is to assess a patient's health. This involves a comprehensive evaluation of the patient's physical condition, as well as an understanding of their medical history and current symptoms. Nurses use their clinical skills and judgment to identify potential health issues and develop appropriate care plans. That means taking the time to really listen to their concerns, to understand their medical history, and to perform a thorough physical examination. Nurses are trained to pick up on subtle cues that may indicate a deeper issue, and they use this information to provide personalized care. Their ability to connect with patients on a personal level is what sets them apart. They're constantly monitoring vital signs like heart rate and blood pressure, looking for any changes that could indicate a problem. This vigilance is crucial in detecting early signs of complications and ensuring timely intervention. Nurses are often the first to notice when something is amiss, and their quick actions can make all the difference in a patient's outcome. And let me tell you, those subtle changes can mean everything. A slight increase in heart rate or a drop in blood pressure can be the first sign of a serious issue. Nurses are trained to recognize these changes and respond appropriately, whether it's adjusting medication, alerting a doctor, or providing immediate care. Their attention to detail is a critical component of patient safety. Of course, nurses also administer medications, assist in medical procedures, and educate patients about their health. They play a key role in the treatment process, ensuring that patients receive the correct medications and understand how to take them. Nurses also provide valuable education on managing chronic conditions, preventing illness, and promoting overall health and wellness. They're the ones explaining things in plain English, making sure patients understand their treatment plans and feel empowered to take control of their health. This education is essential for helping patients make informed decisions about their care and for promoting long-term health outcomes. Nurses are advocates for their patients, ensuring that they have the knowledge and resources they need to thrive. But perhaps most importantly, nurses are the first line of defense. They are the vigilant guardians of patient health, always on the lookout for signs of trouble. Their ability to quickly assess and respond to changes in a patient's condition is vital in preventing complications and ensuring the best possible outcomes. They're the ones who notice when something isn't right, who recognize the subtle signs of a worsening condition, and who take swift action to help. Whether it's administering emergency care, coordinating with other healthcare professionals, or providing emotional support, nurses are always ready to step in and make a difference. Their dedication and expertise are the backbone of the healthcare system, and their impact on patient care is immeasurable. When you think of a nurse, you probably picture a hospital setting, right? And while it's true that many nurses work in hospitals, their reach extends far beyond those walls. Nurses are an integral part of doctors' offices, where they provide a wide range of care. From taking patient histories to assisting with examinations, they're in schools, caring for our children and educating them about health and wellness. They're in nursing homes, providing compassionate care to our elderly population, and they're even in patients' homes offering personalized care and support in the comfort of their own surroundings. And then there's the world of telehealth, which has become increasingly important in recent years. Telehealth nurses connect with patients remotely, using technology to provide care and support over the phone or through video calls. It's an incredible way to reach patients who may not have easy access to healthcare. So as you can see, nurses are everywhere. They're an essential part of our healthcare system no matter where they choose to practice. The field of nursing is incredibly diverse, offering a wide range of career paths for those with a passion for caring for others. From bustling hospitals to serene community clinics, nurses are the backbone of the healthcare system, providing essential care and support to patients in various settings. Just like in surgery, there are different specialties, different areas where nurses can focus their skills and expertise. Whether it's working in a high-pressure emergency room, a specialized surgical unit, or a pediatric ward, each nursing role requires unique skills and knowledge, and it all starts with education and training. Aspiring nurses undergo rigorous academic programs and hands-on training to prepare for the challenges of the profession. From classroom learning to clinical rotations, every step is crucial in shaping competent and compassionate nurses. Licensed practical nurses, or LPNs, are the backbone of many healthcare settings. They play a vital role in providing basic nursing care and ensuring the well-being of patients. LPNs often work under the supervision of registered nurses and physicians, making them an integral part of the healthcare team. They provide basic nursing care such as checking vital signs, monitoring patients' health, and reporting any changes to the supervising nurse or doctor. Assisting patients with daily living activities, such as bathing, dressing, and eating, ensuring that patients maintain their dignity and comfort during their stay, and administering medications under the supervision of an RN or physician. This includes giving oral medications, injections, and sometimes even intravenous medications, depending on their training and the regulations in their region. Registered nurses, or RNs, have a higher level of education and training. They typically hold an associate or bachelor's degree in nursing and have passed a national licensing exam. They're responsible for more advanced tasks like administering treatments, coordinating patient care, and developing care plans tailored to each patient's needs, and educating patients and their families about their health conditions. This education helps patients understand their diagnoses, treatment options, and how to manage their health at home. And then, there are nurse practitioners, or NPs. These advanced practice nurses have completed graduate-level education and have additional clinical training. These highly skilled nurses have advanced training and education, allowing them to diagnose conditions, prescribe medications, and develop comprehensive treatment plans, and manage treatments, much like a physician. NPs often work in primary care settings, providing a wide range of healthcare services to patients of all ages. The beauty of nursing is that there's a path for everyone, no matter your interests or career goals. Whether you want to work in a fast-paced hospital environment, a community clinic, or even pursue advanced practice roles, the field of nursing offers endless opportunities for growth and fulfillment. Nurses are the heart and soul of healthcare. They're the ones who spend the most time with patients, who build those crucial relationships built on trust and compassion. They're the ones who notice the little things, the subtle changes in a patient's condition that could easily be missed, and they're the ones who advocate tirelessly for their patients, ensuring they receive the best possible care. Nurses provide a level of emotional support that's hard to quantify. They're there to listen, to offer words of encouragement, and to simply be present during some of the most challenging times in people's lives. They understand that healing is about more than just treating physical ailments. It's about addressing the emotional and mental well-being of the whole person. Hospitals and clinics simply wouldn't function smoothly without nurses. They're the ones who keep things running, who ensure patients receive their medications on time, who coordinate care between different healthcare providers. They're the glue that holds the healthcare system together. So, you're feeling inspired, right? Maybe you've always had a passion for helping others, or perhaps a recent experience has sparked your interest in the medical field. You're thinking, maybe nursing is the path for me. It's a noble profession, one that offers the chance to make a real difference in people's lives every single day. And you know what? It very well could be. Nursing is a career that not only demands skill and knowledge, but also compassion and resilience. The first step is to do your research. Understand what the role entails, the different pathways you can take, and the various specializations available. Look into different nursing programs both at colleges and universities as well as dedicated nursing schools. Each institution offers unique opportunities and resources. Each program has its own strengths and areas of focus, so find one that aligns with your interests. Some may emphasize clinical practice, while others might focus more on research or leadership. Once you've chosen a program, it's time to hit the books. You'll be diving into a rigorous curriculum designed to equip you with the knowledge and skills needed to excel in the field. You'll delve into the world of anatomy and physiology, pharmacology, and nursing theory. These subjects form the foundation of your nursing education. It's challenging, no doubt, but it's also incredibly rewarding. The sense of accomplishment you'll feel as you master these complex topics is unparalleled. But it's not just about classroom learning. Nursing education is a blend of theoretical knowledge and practical skills. You'll also have the opportunity to gain hands-on experience through clinical rotations in various healthcare settings. This is where the real learning happens. This is where you'll put your knowledge into practice, working alongside experienced nurses and healthcare professionals, and caring for real patients. These experiences are invaluable, providing you with a glimpse into the day-to-day realities of nursing. After you've completed your nursing program, you'll be ready to take the next big step. You'll need to pass a rigorous exam called the NCLEX, or National Council Licensure Examination. This is a critical milestone in your journey. This exam tests your knowledge and skills, ensuring you're prepared to provide safe and effective nursing care. It's a comprehensive test that covers all aspects of nursing, ensuring you're prepared to provide safe and effective nursing care. Passing this exam is a testament to your hard work and dedication. And then comes the exciting part, starting your nursing career. This is where all your hard work pays off. You'll have the opportunity to choose from a variety of specialties and work settings, from hospitals and clinics to schools and community health centers, and you'll continue to learn and grow throughout your career. Nursing is a lifelong journey of learning and development, with endless opportunities for advancement and specialization. Nursing is more than just a job, it's a calling. It's about making a real difference in the lives of others, about being that beacon of hope and compassion in times of need. It's about using your skills and knowledge to ease suffering, to promote healing, and to empower patients to take control of their health. If you're someone who's naturally empathetic, who thrives in fast-paced environments, and who's driven by a desire to help others, then nursing might just be the perfect fit for you. It's a challenging profession, there's no doubt about that. You'll face long hours, emotional exhaustion, and the constant pressure of making life-or-death decisions, but the rewards are immeasurable. You'll experience the profound satisfaction of knowing that you're making a real difference in the world, one patient at a time. So, if you've ever considered a career in nursing, I encourage you to explore it further. Talk to nurses, shadow them if you can, and learn as much as you can about this incredible profession. Thanks for joining me on this journey into the world of nursing. I hope this video has given you a glimpse into the challenges, the rewards, and the incredible impact that nurses have on the lives of their patients. Remember, nurses are the unsung heroes of healthcare, the ones who work tirelessly behind the scenes to ensure that patients receive the best possible care. They're the heart and soul of the medical profession. If you're interested in learning more about nursing, be sure to subscribe to my channel and hit that notification bell so you don't miss any future videos. And feel free to leave any questions you have in the comments below.
You won't want to miss any of the videos in the series. If you have not subscribed to my channel, please go ahead and do that right now so you can be notified when I post a new video. Thank you for being here. God bless you.